Distribution. Distributors are hungry for innovative new products, but they want to pay less for them than the less innovative products. So they're interested. There are a lot of non-traditional players entering the market, but there, like I say, there is a big price squeeze, a lot of downward price pressure, moving patients to the most profitable product for them. So they're not really your friends. I do have good distribution relationships with a number of folks, McKesson being one of them. They've helped me a lot, and they're willing to pay a little bit more because they recognize the value of what we're doing. But you just have to realize that that's the motivation of the distributors. And right now, what we've got is we've got a value chain that does not reward gains in overall health or reduction in cost because it's really a fee-for-service system. Physicians, on the other hand, there are lots and lots of products that physicians are bombarded with on a daily basis. With our particular one, what we've heard is I don't have time to look at this data, and I won't get paid anyway. So they're used to looking at blood glucose data every 3 to 6 months when the patient comes in, flipping through it for 8 minutes during that office visit, trying to make some determination about it. And so they're a little bit reticent to do this as well. The endoscopy, the last company that I had became a division of Stryker, and I like to use the endoscopy example because no one wanted to do minimally invasive surgery. None of the open cutters, the open surgeons, wanted to go to minimally invasive surgery. It wasn't until the patients said, "Hey, less time in the hospital, less scarring, less risk of infection, less complications, less pain." I think I sort of like this minimally invasive surgery thing, and that basically forced open surgeons to either learn minimally invasive surgery or to retire. And that transition has been made. I think that same thing is going to happen with wireless health. I think we're just going to get there, but it's going to be a longer road. And so from a physician standpoint of I don't have the time to do this, what we have to do is we have to show them how we can be more efficient in their practice, right? We'll give them time back because we'll automate a lot of this. We'll have the automated text messages, emails, integration, data going straight into the electronic health record, that kind of thing. They're worried about liability for not responding to patient data. I mean, I've heard this quite a bit from physicians. So from a regulatory standpoint and from a legal standpoint, we have to somehow help them get past that issue of liability. We have to say, more information provided in a clear way, understandable way, is better. And you're not going to be liable just for receiving that information because they're worried if they get a blood glucose reading that's a 20 or 40, which means the patient could be ready to pass out or passed out. They're worried about what's going to happen if they don't see it or don't react to it immediately. But really, it's working through that liability issue. Large entrenched players and relationships. It's difficult to get physicians' attention if you don't have a name, no matter how innovative your product is. But we're really pushing toward patient personal responsibility in this. We're talking about an overall system that allows for patient personal responsibility, gets them more engaged, is more holistic from both the not just the blood glucose testing, but the nutrition aspects, the exercise. And this is sort of a microcosm of what is happening across wireless health with the wireless, sort of the wireless uptake. The wellness uptake. It's more of a wellness situation rather than a diagnose and treat situation. So a couple of opportunities that have worked very well for us. St. John's Hospital. St. John's had a lot of gestational diabetic patients. So pregnant women can get a form of diabetes called gestational diabetes. It's actually quite common. And so it's very important for them to monitor their blood glucose successfully. And believe it or not, a lot of them weren't. It was inconvenient. They had to come into the hospital or the clinic to test on a regular basis. Sometimes they made it, sometimes they didn't. And so what we did was we provided them with an innovative way, a wireless meter and mobile application, to test their blood glucose. They've got the physicians looking at that data on a regular basis, and it's been really, really successful. Genuine excitement around the solution, and although it's a small trial and we're hoping for big things from it, it doesn't pay the bills. And we want to make sure that these trials get more publicity and are expanded. And typically what we do is we start off with a trial, and the trial will never end. It will just sort of expand into a regular, a regular part of the physician practice. Another one that we're working with in LA is called GlucoFit Club. Again, this is a fitness and blood glucose testing and nutrition program that's being sponsored by the YMCA of Orange County. It's interesting because it's mixing reimbursable with unreimbursable things. Everybody's sort of used to paying for a health club membership, and everybody's used to not paying for diabetes testing supplies. So what we did is we put together a program that allowed sort of a combination of both. You get your meter, you get your testing, you get your YMCA membership, all for a price which is reasonable, some of which is reimbursed and some of which is not reimbursed from a payer standpoint. But the overall approach and the overall result is better blood glucose control for these patients, lower A1C, so an overall measure of blood hemoglobin over time, and more frequent exercise and significant weight loss. So here's a program which is a mixing of reimbursable and unreimbursable pieces that has been very successful in improving the overall health of these diabetic patients. So it's sort of an interesting mix.